In an era characterized by dramatic shifts in political and scientific landscapes, recent developments surrounding the Trump administration have cast a long shadow over the future of American democracy and public health. As the nation grapples with an alarming trajectory towards autocracy and a significant overhaul of its health policies, experts are raising red flags that could alter the fabric of American society. Recent analyses suggest that the United States is edging closer to autocratic rule, as outlined by political scientist Daniel Stockemer of the University of Ottawa. His report highlights a six-step theory of incremental autocratization wherein the U.S. appears to have already crossed the first three thresholds. These steps, which detail the gradual erosion of democratic norms, find troubling parallels in the U.S. political climate today. Since Donald Trump's inauguration, the country has embarked on the slippery slope toward autocracy, Stockemer noted, underscoring a series of alarming actions taken by the administration that undermine the rule of law and democratic institutions. As President Trump continues to exert influence over government agencies and public discourse, scholars have pointed out that his administration's actions are not merely a reaction to opposition but a calculated dismantling of checks and balances. Law professor David Pozen of Columbia University aptly described the administration's disregard for civil liberties as indicative of an authoritarian regime. The depth and breadth of this administration's disregard for civil liberties, political pluralism, and legal constraints mark it as an authoritarian regime, Pozen remarked. Simultaneously, the health sector is facing upheaval under the leadership of Health Secretary Robert F. Kennedy Jr., whose recent policies have sparked fierce backlash from both the scientific community and the public. Ahead of a critical testimony in Congress, Kennedy is expected to defend sweeping budget cuts that threaten vital research and public health initiatives. These cuts, which include a staggering reduction of 20,000 jobs within the Department of Health and Human Services, have left many to question the long-term implications for health research and disease prevention. Critics, including Senator Bernie Sanders, have harshly condemned these cuts as part of an unprecedented, illegal, and outrageous attack on science and scientists. A recent poll indicated that a majority of Americans opposed the drastic reductions in funding and staffing at health agencies, raising concerns about the administration's commitment to public health. Trump's war on science is an attack against anyone who has ever loved someone with cancer, Sanders stated, highlighting the real-world consequences of these policy changes. Young researchers, who are vital to the future of scientific innovation, are particularly vulnerable to the fallout from these budget cuts. An analysis from the Journal of the American Medical Association revealed that the National Institutes of Health has already canceled over $1.8 billion in grants, while the National Science Foundation is poised to lose $4.7 billion of its budget. This trend threatens not only the current workforce but also the next generation of scientists who rely on stable funding to pursue critical research. As the nation stands at this crossroads, the implications of these concurrent trends, the drift towards autocracy and the dismantling of public health infrastructure, are profound. The potential for democratic erosion looms large, as do the health risks posed by an underfunded research landscape. Yet experts remain hopeful that the courts could serve as a bulwark against further encroachment on democratic norms and that public discontent could galvanize political action. As Americans navigate these tumultuous times, the path forward remains uncertain. The interplay between political authority and scientific integrity will be vital in shaping the future. With impending developments in both the political arena and public health sector, the pressing question remains: how will the nation reconcile its democratic values with the realities of governance in an increasingly polarized climate? The coming months are bound to reveal whether the U.S. can steer back from the brink of autocracy and reinvigorate its commitment to science and democracy. A groundbreaking advancement in malaria vaccination has emerged from a research team led by scientists at the University of Copenhagen. On May 14, 2025, they unveiled a modular mRNA vaccine platform that encodes capsid virus-like particles, significantly enhancing the immunogenicity of the malaria antigen PFS25. This innovative approach not only demonstrates the potential of mRNA technology, which surged to prominence during the COVID-19 pandemic, but also addresses some critical challenges associated with vaccine development. The COVID-19 crisis highlighted the versatility and rapid development capabilities of mRNA vaccines, but it also exposed limitations including dose-limiting reactogenicity and the need for durable humoral immunity. The new modular platform integrates the benefits of both genetic vaccines and capsid virus-like particle VLP technologies, enabling a more effective display of antigens. As noted in the study, this platform allows for the display of various antigens on different capsid virus-like particles, improving the magnitude, quality, and longevity of the vaccine-induced immune responses. In their research, the team immunized subjects with lipid nanoparticle-formulated mRNA encoding PFS25 capsid VLPs. The results were promising, revealing significantly higher and potentially more durable anti-PFS25 antibody responses compared to traditional mRNA vaccines encoding soluble PFS25. This enhanced immune response is crucial, as it not only boosts the effectiveness of the vaccine but also has the potential to reduce the required doses and frequency of administration. Morten Agertug Nielsen, one of the study's authors, emphasized the implications of their findings. By improving both humoral and cellular immune responses, this approach may reduce the dose and number of administrations required for effective protection. This could have far-reaching consequences for vaccine distribution, particularly in resource-limited settings where access to healthcare may be limited. Moreover, the modular nature of the platform opens avenues for broader applications, including DNA and mRNA-based vaccines targeting both pandemic and endemic infectious diseases. Such adaptability could revolutionize the vaccination landscape, making it easier to respond to emerging health threats. While these advancements signal a promising future for malaria vaccination, the research community remains vigilant regarding the ongoing challenges of mRNA vaccines, such as stability and immune response variability. Continued investment and innovation in this field are necessary to fully realize the potential of RNA-based therapies. As researchers continue to refine and optimize this vaccine platform, its successful implementation could not only play a pivotal role in the fight against malaria but also serve as a model for future vaccine development against various infectious diseases. The implications of this study extend beyond malaria, potentially paving the way for a new generation of vaccines that are both effective and accessible to those who need them most. The future of infectious disease prevention appears brighter, fueled by the lessons learned from recent global health challenges and the transformative power of mRNA technology in the relentless pursuit of advancing cancer treatments. Researchers are exploring innovative pathways to overcome the challenges posed by drug resistance and the aggressive nature of various cancers. At the forefront of this research is Dr. Luis Mori, an associate professor at the Sylvester Comprehensive Cancer Center at the University of Miami. Since establishing his lab in 2016, Dr. Mori has focused on understanding the molecular mechanisms of resistance in breast and head and neck cancers, aiming to lay the foundation for new therapeutic strategies. Dr. Mori's journey began in Mallorca, Spain, where he earned his PhD before completing postdoctoral fellowships in Europe. His move to Miami was motivated by the opportunity to work under Dr. Stephen Nimmer, the director of Sylvester, who emphasized the significance of basic science in developing effective cancer treatments. Dr. Mori explains, "You need to understand what the problem is in order to identify new pathways to explore and to develop new drugs. This fundamental approach has guided his research into cancer epigenetics, an area that examines chemical modifications in DNA that can be reversed, thus offering a potential avenue for treatment." Recently, Dr. Mori's team made significant strides in identifying a potential treatment for head and neck cancers. Their research revealed that approximately 20% of patients with these cancers exhibit specific defects in histone modification, which can be targeted using existing FDA-approved drugs olaparib and decitabine. What we are trying to do now is team up with head and neck surgeons to see whether we could open a clinical trial combining these two drugs in patients that have advanced disease. Dr. Mori noted, This collaborative effort highlights the promise of repurposing existing medications to benefit patients who have developed resistance to conventional therapies. In addition to head and neck cancers, Dr. Mori's work extends to triple-negative breast cancer, a particularly aggressive form that lacks targeted therapies. Through his lab's findings, researchers have identified a new set of proteins that may serve as potential targets for treatment. Dr. Mori emphasizes the importance of basic science in these discoveries, stating, "Our work is very basic science oriented, always with the hope of one day being translational." This foundational research is crucial for inspiring new drug development and ultimately improving patient outcomes. Meanwhile, at the University of Virginia, a different approach to cancer treatment is gaining momentum. Natasha Shibani, the research director at the Focused Ultrasound Cancer Immunotherapy Center, has recently received a $5.5 million grant from the Department of Defense to explore how ultrasound technology can enhance the safety and precision of immunotherapy drugs for cancer patients. Shibani's research aims to leverage ultrasound to improve drug delivery and minimize the harsh side effects associated with traditional therapies like chemotherapy and radiation. Breast cancer therapies are still very harsh and we leave a lot of room for off-target toxicity, she explained. Focused ultrasound presents a revolutionary opportunity to treat cancers more effectively while reducing the invasiveness of existing procedures. By heating cancerous cells or aiding drug penetration, this method may provide a less invasive alternative to surgeries and could significantly improve the quality of life for patients undergoing treatment. In another innovative approach, researchers are investigating a novel class of immune-based drugs known as DNA-encoded trispecific T-cell engagers, DTRiTs. This strategy is particularly relevant for tackling aggressive forms of cancer such as glioblastoma multiforme, which often evade conventional treatments. The DTRiTs work by linking tumor cells to T cells, effectively directing the immune system's attack on cancer. Initial preclinical studies have shown promising results with significant tumor shrinkage and prolonged control over the disease. As the field of cancer research continues to evolve, these innovative studies underscore the importance of collaboration, basic science, and the integration of new technologies in the fight against cancer. The potential for developing more effective treatments offers hope to countless patients and their families navigating the challenges of cancer. As Dr. Mori aptly puts it, basic science is key, absolutely key to progress. With ongoing research efforts, the future of cancer treatment looks increasingly promising, paving the way for breakthroughs that could transform patient care in the years to come. In an era where artificial intelligence (AI) is increasingly being integrated into diverse fields, the medical sector is not exempt from its transformative potential. Recent advancements have sparked an urgent conversation about fairness in AI-driven medical text generation, as highlighted in a study published by researchers Yumeng Zhang and Jiangning Song in the journal Nature Computational Science. The research investigates biases in AI-generated medical language, revealing significant disparities based on age, sex, and ethnicity. This exploration of bias is not merely academic. It raises crucial ethical considerations as AI systems become more prevalent in healthcare communication. The study identifies how AI models can inadvertently propagate existing biases, which can lead to inequitable healthcare outcomes. Our findings indicate that AI-generated texts often reflect societal biases, which could exacerbate existing disparities in healthcare delivery, said Zhang. To address this issue, the researchers propose a novel optimization technique aimed at enhancing fairness in AI outputs without compromising performance. This balancing act is critical as the medical field increasingly relies on AI for generating patient information, treatment recommendations, and even clinical documentation. The implications of this research extend beyond theoretical discussions. They challenge developers and healthcare professionals to consider the ethical ramifications of deploying AI in clinical settings. As AI continues to evolve, the need for robust frameworks ensuring fairness in its applications becomes paramount. By addressing these biases proactively, the medical community can harness AI's potential while safeguarding against its pitfalls. Meanwhile, in a related discourse on AI's capabilities, the relevance of the Turing test has come under scrutiny. Originally proposed by the legendary mathematician Alan Turing in 1950. The test aimed to measure a machine's ability to exhibit intelligent behavior indistinguishable from that of a human. However, the rise of sophisticated large language models (LLMs) like GPT-4 has led experts to question whether the Turing test remains a valid benchmark for assessing AI intelligence. Recent research indicates that GPT-4 was identified as human 54% of the time during a modified Turing test, surpassing Turing's original prediction. However, this interpretation lacks the rigor of Turing's three-party framework, calling into question the depth of the assessment. Experts like Eleanor Watson, a member of the Institute of Electrical and Electronics Engineers, argue that the Turing test may no longer suffice in evaluating AI's capabilities. The challenge isn't whether AI can fool humans in conversation, Watson states, but whether it can develop genuine common sense and reasoning aligned with human values. With AI's growing role in decision-making processes, there is an increasing need for evaluations that go beyond mere imitation of human behavior. As Watson notes, future assessments of AI should focus on enhancing human capabilities rather than simply simulating them. The urgency for this shift is amplified by the potential risks and ethical concerns associated with AI systems, which must be carefully navigated to ensure technology serves humanity rather than undermines it. In another significant development, Rice University hosted the Health Innovations Symposium, showcasing the collaboration between academia and the Texas Medical Center (TMC). This two-day event gathered over 400 participants, including researchers, clinicians, and biotech entrepreneurs, to explore advancements in biomedical research and innovation. The symposium underscored the importance of strategic partnerships in driving breakthroughs in areas such as cancer research and AI applications in healthcare. President Reginald Desroches emphasized the potential of such collaborations, stating, "Our partnerships make us stronger. They accelerate innovations in health that give people a higher quality of life." The event highlighted various thematic areas, including the integration of AI in medical decision-making and tackling persistent health disparities through innovative technologies. As the fields of AI and healthcare converge, the importance of ensuring equitable access to these advancements cannot be overstated. The symposium served as a platform for discussing the impact of emerging technologies on patient care and the need for ongoing dialogue about the ethical implications of their use. Looking ahead, the intersection of AI and medicine is poised for significant growth, driven by continued research and collaboration. As institutions focus on harnessing AI's capabilities while addressing ethical concerns, the future promises a more equitable and effective healthcare landscape. The ongoing challenge will be to navigate this complex terrain, ensuring that technological advancements enhance patient care and uphold the principles of fairness and equity. In an ambitious bid to revolutionize the energy landscape, the US-based startup Rialta Fusion has unveiled plans for a novel bottle-shaped nuclear reactor aiming to harness the power of nuclear fusion. This innovative design seeks to position itself as a competitive alternative to traditional natural gas power plants, promising not only cost efficiency but also a cleaner energy solution devoid of carbon emissions. The announcement comes on the heels of Rialta securing $36 million in series of funding, a move that bolsters its efforts to develop a prototype reactor by 2026. Nuclear fusion, often regarded as the holy grail of energy production, mimics the natural processes of stars, where hydrogen fuses into helium, releasing vast amounts of energy. Despite decades of research and development, the commercialization of this technology has remained elusive, with many startups struggling to secure the necessary funding and technical breakthroughs to bring their concepts to reality. Currently, nearly 50 companies are vying to make nuclear fusion a viable energy source, underscoring the intense competition and high stakes involved. Rialta Fusion's reactor design centers on a concept known as magnetic mirrors. This method utilizes powerful magnets to confine a superheated plasma mixture within a symmetrical bottle-shaped chamber, creating the conditions necessary for fusion to occur. The reactor's longer midsection allows for the use of relatively weaker magnets which can be manufactured at a lower cost, thus enhancing the feasibility of the technology. The company aims to generate fusion energy at an initial rate of $100 per megawatt with the goal of driving costs down to $40 per megawatt, a price point that would position it competitively alongside natural gas plants. Rialta's recent funding round, supported by notable investors such as Future Ventures, Kozla Ventures, and the Wisconsin Alumni Research Foundation, reflects a growing confidence in its approach at a time when many fusion companies face hurdles in demonstrating significant advancements. Since its inception as a university spin-off 3 years ago, Rialta has not only developed its magnetic confinement technology but has also set a record for plasma confinement, paving the way for future developments. The company is now focused on refining its technology to transition from concept to reality, with hopes of constructing its prototype reactor dubbed Anvil, using proceeds from future funding rounds. The potential impact of successful nuclear fusion extends far beyond just energy production. Should Rialta and others in the sector overcome the technological and financial challenges that have historically plagued fusion projects, the implications for global energy production could be monumental. Fusion technology promises a sustainable energy source with minimal environmental impact, which is crucial as the world grapples with climate change and seeks cleaner alternatives to fossil fuels. In parallel developments, other companies like TAE Technologies are also making headway in the fusion space. TAE recently reported significant advancements with its own nuclear fusion project, which utilizes a field-reversed configuration FRC technology to achieve high energy yields with a focus on hydrogen boron fuel, touted as one of the cleanest and most sustainable options available. Their innovation, a new particle accelerator named NORM, aims to reduce the cost and complexity of fusion reactors, potentially cutting operational costs by up to 50%. As the global demand for energy continues to rise, the urgency for sustainable and efficient energy solutions is more pressing than ever. The successful commercialization of nuclear fusion technology could not only transform the energy landscape but also mitigate the climate impact of energy generation, providing a pathway to a carbon-free future. Looking ahead, the progress made by Rialta Fusion and other players in the field will be crucial in determining the feasibility of fusion as a mainstream energy source, with the potential for significant advancements expected in the coming years. In a significant advancement in the field of materials science, researchers have unveiled a novel numerical method designed to enhance the design of topological superconductors (TSCs) that utilize S-wave pairing. This innovative approach, detailed in a recent publication in NPJ Computational Materials, aims to address the challenges of identifying and predicting materials capable of exhibiting topological superconductivity, a key element for future quantum computing technologies. Topological superconductors are of particular interest due to their potential to host Majorana zero modes, exotic quasiparticles that could serve as stable qubits for topological quantum computation. Despite growing theoretical interest since their introduction in the early 2000s, practical experimental realizations of TSCs have remained elusive, primarily due to the complexity involved in accurately modeling the intricate electronic structures of real materials. The research team, comprising Jingnanhu Ian Luojijun Wang Jingyuzo Quanchengwu and Gang Su, has developed a numerical method implemented in the open-source software Wannier Tools. This method allows for a precise characterization of the superconducting spectrum and topological invariance of two-dimensional slab systems using first principles band structure calculations. Notably, the team integrated a phenomenological theory of superconducting pairing decay into the program, facilitating a more accurate modeling of the superconducting proximity effect. Demonstrating the robustness of their method, the researchers applied it to various materials, including the topological crystal insulator SNT, the Rashba semiconductor INSB, and the superconductor NBSA2. Their findings indicate that this numerical tool could significantly accelerate the discovery of new candidates for topological superconductors, potentially leading to breakthroughs in high-temperature superconductivity and advanced quantum computing applications. The authors highlight that the method bridges a crucial gap between theoretical predictions and experimental outcomes by enabling a detailed analysis of the physical mechanisms that give rise to TSCs. The program's ability to simulate classical superconductor topological insulator SCTI heterostructures, SC semiconductor interfaces, and intrinsic topological superconductors opens up new avenues for material exploration. As the field of superconductivity continues to evolve, the implications of this research extend beyond TSCs to a broader understanding of correlated electronic systems. The ability to fine-tune material properties through advanced computational techniques paves the way for the development of next-generation quantum technologies. In conclusion, the numerical method introduced by Hu and colleagues represents a promising advancement in the quest to design and identify topological superconductors. As researchers continue to refine these computational tools, the potential for discovering new materials that could revolutionize quantum computing becomes increasingly feasible, heralding a new era in materials science and condensed matter physics. Future investigations will likely focus on applying this method to a wider array of materials, further pushing the boundaries of our understanding of superconductivity and its applications.